This is my buddy, Ashley.
Yes.
Methodist is unique in their approach to cancer care because we have the ability to provide multidisciplinary care truly under one roof.
I think it's totally different than any kind of care in the healthcare system.
Your blood pressure looks a lot better today.
Good.
Yeah, it does.
I get to see people at a very, very scary time in their life, and I get to help them navigate that.
The main thing I want to be able to do is give patients a good idea of what to expect. I like to walk them through the entire process.
So whether they need to talk about stuff, they need to vent, they need to cry, they need, they need me to yell at them, they need me to, I try to be whatever the person needs me to do. Okay, looks good. And whatever it takes to get them where they're going.
And reassure them that they have a team here at Methodist that will support them every step of the way.
And yeah, you're holding way better.
I think the uncertainty is definitely a very difficult part.
Obviously, the unknown about what they're going to expect going through the surgery or going through the treatments is also uneasy and scary.
If I could take away the waiting for people, it would be such a blessing because that is the hardest part.
The cases where we see the disease come back or spread to another part of the body, those are always difficult situations. And I think it's always great to see the success stories, but I think having to deal with the more unfortunate cases is also an important part of what we do.
Don't miss this. Yes.
Really, it comes down to, in my opinion, validating that this is a hard thing for them.
We have outstanding physicians, surgeons, oncologists, ancillary services, wonderful pathologists and radiologists that have looked at slides for me in the evening just so that I can get a diagnosis for a patient the following morning.
There really isn't a better feeling than seeing patients, disease respond well to treatment, seeing their, in some cases, their disease go away, and seeing the way that makes them feel.
I think Estabrook and the cancer center that they've developed here has really become top notch, and they're, really focusing on survivorship and, trying to make sure they cover all aspects of care, which I think is really important.
I know our core values and our mission, I align with them. I align with all of that, and I think that there's no other place that you can get care than Methodist.
I think the greatest thing I've learned is how to be more appreciative in general, whether that's appreciative of my friends, family, support systems around us. The opportunity to be here every day. I think a lot of patients have really shown me how to prioritize things in life, where to find meaning, appreciate the small things.
They've gone through a lot, and they teach us a lot.
Thank you very much.
Thanks, guys.
Thank you.
Take care of yourself. Yeah, I will. I promise.
My advice I give to everyone is motion is lotion. So keep moving, keep being as active as you can, keep living your life.
For somebody who's going through the cancer journey, they don't have to go through it alone.
Oh, be careful what you say.
We're going to be right here with you every step of the way, and I know it's scary or it's whatever that feeling is right this minute, but we're going to move forward and we're going to take care of you.
They're facing this unimaginable diagnosis, and I can't even pretend to know how I would react or how I would feel, and yet they all face it and move forward and do it with so much strength and grace, and it's truly inspiring, and it definitely helps me be better at my job and gives me the energy to continue to do my job because I'm fueled by their resilience and strength.